ปีนี้ครบรอบ 70 ปีวันอนามัยโลกนะคะเมื่อวันที่ 7 เมษายนที่ผ่านมาค่ะองค์การอนามัยโลกย้ำถึงความสำคัญของนโยบายหลักประกันสุขภาพทั่วหน้าซึ่งก็เป็นพันธกิจหลักขององค์กรไทยนะคะที่จะเดินหน้านโยบายหลักประกันสุขภาพทั่วหน้ามา 15 ปีแล้วค่ะและถือว่าเป็นแถวหน้าของโลกด้วยนะคะที่มีนโยบายนี้คุณณฐา โกมลวทินค่ะคุยกับผู้แทนองค์การอนามัยโลกประจำประเทศไทยถึงความหมายของระบบหลักประกันสุขภาพทั่วหน้าค่ะ
UHC is really about people having access to quality health services where they need them, when they need them, at an affordable cost. So there's really three important elements here. Universality of quality health services at an affordable cost.
Thailand has adopted this policy for 16 years. In what capacity of Thailand that you think we can share this knowledge with the world, with UHC?
Thailand is a global pioneer in achieving universal health coverage, and they've really been a model globally. They've showed how a country, a lower middle income country, because at the time that Thailand achieved universal health coverage, it was not a wealthy country, it was not a middle income country. They've shown how a country-born, country-led effort was able to bring UHC to the population.
Why is it so hard to convince many countries around the world to really introduce UHC in their policy?
I don't think that the issue is convincing. I think most countries are convinced that universal health coverage is really critical. Some countries are unsure about how to achieve universal health coverage. They're unsure about the kind of policies that they need to put in place. I think in many countries, I think one of the reasons why Thailand was very successful in achieving universal health coverage is that there was political will over successive governments, successive administrations. There was a long-term vision for universal health coverage. And I think many countries need to develop a long-term vision for the health of their people.
Should it be left with the government alone in terms of supportive of the budget? 100% should be coming from the government. What should other stakeholders in the society, like private sector or civil society, should be aware of the utilizing of the budget to support this program?
All stakeholders have a role in universal health coverage. So, at the grassroots level, populations have a responsibility and a role to be involved in health, to be involved in decisions within their communities about health services. People in the academic sphere, policymakers, doctors, nurses, health professionals, they all have a responsibility to provide, to train themselves and to make sure that they're able to provide the best, highest quality health services they can, and also to look at the evidence around the health services that they're providing. And I think finally politicians have a responsibility to listen to their constituencies. They have a responsibility to foster an open dialogue where people can discuss challenges to universal health coverage. I love the analogy of the triangle that moves the mountain. I think Thailand achieved universal health coverage by the triangle that moves the mountain. They combine social power, social movements, with knowledge, evidence, understanding of what works and what doesn't work, and political will and political power.
Is there any evidence or the downside that we should be aware of, that people may be thinking that this can be used as political tools or becoming populism policy?
I'm a health expert. I work for the World Health Organization. We don't see a downside to universal health coverage. We believe that universal health coverage is important for two reasons. One, because it's the right thing to do for individual people. Okay? People should not, as I said before, should not have to choose between poverty and their health. So it's the right thing to do for people. But what people don't realize, it's also the right thing to do for the health and well-being of the nation as a whole. Universal health coverage is a great investment. It creates jobs for people. As you expand your health sector, it creates jobs in the health sector. It brings people out of poverty. People don't have to spend large amounts of money and then become poor. It helps to protect people from epidemics and diseases. As you strengthen your health system, it helps protect people from health emergencies. So it's a really good investment.
For the case of Thailand, you think we are on the right track and we should carry on pursuing this policy, even though the government perhaps is quite concerned with the budget?
There are always challenges to universal health coverage, and one of the really critical challenges is cost. I mean, and we talked a little bit about new technologies, and as new technologies come on board, countries have to choose between, they have to evaluate the technology against, they have to evaluate the usefulness or the effectiveness of the technology for improving people's health versus the cost, okay? There's really no right answer to this, but what Thailand has that's really important are mechanisms for considering evidence, looking at the best practices, evaluating things like new health technologies against evidence, and then making decisions that involve all stakeholders. These are the fundamentals. If a country has this in place, they're more than likely to make the best decision.